So what's the assessment about then? We need to think of the assessment as being, is it going to be static? Is that weight going to be static? Or is it going to fluctuate? We know that sometimes plus size people have episodes of binge eating, they have psychological issues, and they sometimes will go on that eating journey. We also need to think about where the weight is distributed, where that spread of weight is, where the centre of gravity of that individual is, especially with the larger leg, because that can affect the balance. It can actually you're going to get less muscle control. And sometimes plus size people can't feel their legs. So you've got to think about that increased risk of falls. Body dynamics I've talked about. When I'm doing a plus size seating assessment, I also use the mobility function independence measure, known as the FIM tool. Now, a lot of you might know what the FIM tool is, and it is a huge tool. But actually, you can take out of that FIM tool sections that you need and design your assessment, your mobility assessment tool from the basics of that FIM tool. It is really good, and I've used it for a long time. Are we going to rehabilitate out that top chair? Rehabilitation is another one. How is that assessment going to include that rehabilitation if you are going to put that into your care plan and within your care regime? The other thing is pressure care, moisture. How are you going to manage the moisture in the skin folds? What are you going to do? What are you going to do with the pannus that's resting on those legs, which will then affect the circulation? How are you going to slightly raise that pannus up so that you can actually allow the circulation to continue? And how are you going to absorb the moisture that is between the legs and the pannus? And also, you've also got shear on shear skin friction. All of these things you need to take into account. You've also got to look at how the positioning in the chair, what the material is, because fatigue, when I do training, sometimes I ask the delegates to sit up and see how long they can sit up for at a certain angle. And if you don't have the correct seating, your plus size individual is going to get fatigue and they're going to start to actually slide down the chair purely because of they're not comfortable, and it's about maintaining their posture. So you're going to get shear and friction there as well. You've also got pain, osteoarthritis, especially in the knee bone or on the bone, and severe joint pain. So they're going to be wriggling about if they can with all these things, all these extra shear and friction, weight and pain as they're sitting in that chair. The other thing I want to consider is respiratory. How are we going to get that person in that chair comfortable so they actually can have good respiratory function, that they have got the tubes that are open, they're able to breathe, they're able to be active, and also nutrition. You know yourself, if you're not comfortable, you might not eat much. So the nutritional and the fluid functions of that individual is important when we are looking and considering the seating for a plus size person. And carrying on with the assessment, what else do we need? Well, one is manual handling. How are we going to handle that person within that chair? What equipment are we going to use? We need to decide whether this is static loading in this chair or whether this person is going to be dynamic seated, where the actual person can fall into a chair when they're trying to get into it instead of sitting down like some people do, like we do. They will fall into the chair, those uncontrollable movement, and that weight will double. And then you've got to think about where the weight is if you've got dynamic person, because it will then actually gravitate towards the front casters. So again, static loading, hoisting in, the patient doesn't move. dynamic, where the person has got more movement in that chair. So when you're looking at the chair itself, we have the impact of the transfers, but we've also got to look at the benefits of having a vertical or tilt function within that chair. Okay, because some plus size people can't cope with the tilt function due to their body dynamics. They've got a heavy pannus. If you're going to tilt, is that going to then push them forward and then put them at risk of falls? If the vertical one is better, it's going to bring them up. You will have that more stability for them, where their feet are more stable on the ground and they're much wider through the hips rather than through the trunk. You've got to look at their psychological needs as well, and the positivity of that eye-to-eye contact. And when I'm talking about contact, I'm talking about conversation, talking that person through the task that we're trying to get them to do. And also, we need to think future proofing. Are we going to have to, at some stage, change the cushion within that chair? Will we need to make more extensions to that chair? So the modularity of a chair is another aspect we need to look at. We put the chair in, we need to look at the longevity of the chair and future-proof, if we can, for the future.